Greetings, everyone. This is Eric Hong, Executive Director of Momiji Healthcare Society, speaking to you about COVID-19 pandemic on Wednesday, March 31st, 2021. Firstly, about vaccination against COVID-19. As the Ontario Provincial Plan unfolded, residents in long-term care homes and retirement residents seem to be at highest risk of infection were vaccinated against the coronavirus first. Momiji Seniors residents as an assisted living supportive housing setting was not included in that priority group for early access to the vaccines. Since then, 33 Momiji tenants have already made their own arrangements to get vaccinated. Last Friday, we were able to arrange for a mobile vaccination team to visit Momiji and inoculated 111 tenants while they were on site. At this time, only a few individual tenants have not been vaccinated on account of health and other reasons. Momiji is now a much safer place in the context of the COVID pandemic as a result. Secondly, in terms of testing for COVID-19, a while ago, I had shared with you our concern about family visitors to Momiji Seniors residents at risk of being unwitting carriers of infection risk into Momiji. As a precaution, and to allow for early detection of risk, I had suggested families of tenants get tested regularly, even if they were not experiencing any obvious symptoms suggestive of COVID infection. I have since been made aware that access to testing by asymptomatic persons is available only to intended visitors to long-term care homes and retirement residences, but not to assisted living supportive housing, such as Momiji Seniors residents. As such, we will no longer expect for you to have gotten tested before visiting. I appreciate the effort made by those family visitors who have tried to get tested but were turned away by the testing centers. I apologize for the inconvenience and frustration you have experienced in trying to do the right thing. However, highly contagious COVID variants of concern infections are still on the rise. It is an unfortunate reality that even a vaccinated person can unintentionally act as a carrier of the virus and transmit it to others. We must therefore continue to plead with you to have only one designated visitor to each tenant at Momiji Seniors residence, if at all possible, and also to keep your frequency of visits to a minimum. Thirdly, about lockdown and continued restrictions at Momiji. With most tenants and staff at Momiji having received their first vaccine dose and the weather warming up, everybody is eager to see group programs and social activities within Momiji resume and tenants able to gather together with their family. Although overall vaccination rate is slowly climbing up, the community as a whole has not yet attained what is known as herd immunity, when the risk of infection spread is expected to be decreased. Public health is continuing to caution everyone against letting our guards down. We are being urged to continue practicing careful infection prevention and control. That means continuing to wear a mask at all times, and when interacting with other people is likely. Maintaining a safe distance of 6 feet apart from each other, and washing our hands often with soap and water or hand sanitizers, and wiping tables, doorknobs, and other surfaces before and after use. The Ontario government has been gradually relaxing lockdown restrictions, allowing some social and commercial activities to resume in parts of the province. However, gathering indoor in a setting like the Momiji Seniors Active Living Center is still not permitted. We will only reopen group programs and activities at Momiji when it is safe to do so, and we will await government directions as to when that will be. Please be patient and stay tuned to our announcements. I hope you have found this information useful. If you have any question, please ask any Momiji staff. It is by supporting each other that we have been spared the worst of the pandemic so far. Please continue to cooperate with us, and we will succeed in keeping everyone safe. Thank you.